Managing diabetes can become costly between medication, appointments, and equipment. This section will discuss how to save money on diabetes medication, equipment, and care, and how not to save money. Here are a few ways to save money on diabetes medication. It's a good idea to compare different pharmacies in your area to find the one with the lowest price. You also might want to develop a relationship with your pharmacist so that they know you and know what medications you take. They may also be able to offer some alternatives to you. You can call health insurance companies to find out which medicines are covered to you at the lowest cost, and ask your healthcare team about generic or low-priced alternatives to what you're currently taking. You may also ask about dosing and medication changes that will affect the price that you pay. A few other ways to save money on medication include pharmacy discounts. You can search online or ask your pharmacist or doctor about any available pharmacy discounts in your area. Most drug companies have patient assistance programs that provide free or low-cost medications. You can search the websites shown here to find more information about any available patient assistance programs. SimpleFill.com offers reduced or free medications to uninsured people who can prove financial need. Diabetes supplies can also be costly. This shows a few different ways that you can save money on diabetes supplies. Consider reward programs and price comparisons and discounts of the stores that you shop at. Ask your healthcare team for samples, especially when you're trying a new product. You can apply for discounts on supplies through patient assistance programs, and this would be done through the supplier of the product. Search for coupons online and buy in bulk when possible. The website shown here has more tips on how to save money on diabetes supplies. Saving money on diabetes treatment is also something that you may be interested in. If you don't have health insurance, getting care at a federally qualified healthcare center may be a good choice. At these facilities, they provide care on a sliding fee scale based on your ability to pay and operate under a governing board that includes patients. Depending on your health coverage, you may have the choice to see providers who are in-network or out-of-network. You pay less to see providers who are in your network. This means that they charge lower rates. When choosing a healthcare plan, think about health needs of you and your family. If you pick a plan with higher premiums, more of your healthcare costs will be covered. This may be a good idea if you have a health problem such as diabetes and need regular care. If you rarely need medical care, then you may want to choose a plan with a higher deductible. You will pay lower monthly premiums and likely save money overall. Also compare prescription drug coverage. Many employers offer an HSA or FSA, which are savings accounts that allow you to set aside pre-tax money for healthcare expenses. How to save money on healthy eating. Healthy eating, unfortunately, may feel expensive at times, so some of the things that can help are shown here. Plan meals ahead and only buy ingredients that you know that you need. And cook your own food. Packaged or restaurant food is oftentimes more expensive. Cook in large batches and freeze what you don't need right away. Almost any food can be frozen. Bring your lunch to work instead of buying it. You'll save money and eat healthier too. And buy food in bulk if you can. Choose generic brands instead of higher priced brands, and shop sales and use coupons and rewards cards at your grocery store. And lastly, there are a few ways that you should never cut costs on your diabetes care. Don't ever stop taking medications that you need. And don't skip doses. Splitting pills that aren't meant to be split is never a good idea either. Don't share items that enter your skin, such as finger stick devices and insulin pens. Let your doctor know right away if you're having trouble paying for insulin or medications. So to close our 3-part series on diabetes management, we'll take one last look at the 3-legged stool approach to diabetes management. Each one of these components is just as important as the other for good health and to prevent complications of type 2 diabetes. This concludes our 3-part series on type 2 diabetes management. You can visit the Knox County Health Department website to find more resources on managing type 2 diabetes. Thanks for watching.